Hello, I'm Daniel Golshani. In this video, I would like to talk about a procedure called abdominoplasty or the tummy tuck, which I believe is one of the most transformative procedures that plastic surgeons do. We'll be focusing on the techniques and how it's done and some of the questions that patients commonly ask me about their tummy tuck procedure. In the next slide, we're looking at a diagram of a young female, and I use this to demonstrate what are the aesthetic goals that we try to achieve with the tummy tuck. We want to reach a place where the abdomen is flat, the normal muscle contours are visible, and the abdomen looks youthful. Here in the next slide, we're looking at the technical goals that we have in an abdominoplasty. We want to remove all the loose skin from the abdomen. We want to tighten the abdominal muscles if necessary, and that's really performed in cases where the muscles are loose or there's separation of the muscles, such as in cases where a patient has been pregnant previously. We want to remove the excess fat from the flanks, hips, and the pubic areas, places that are safe to remove the fat. All of these can be included within the abdominoplasty procedure. Restoring a youthful aesthetic contour to the abdomen by tightening the muscles, by removing the excess fat and the excess skin, the youthful contour that the abdomen had prior to this laxity can all be brought back. And last but not least, we want to place the incisions in a way that they are hidden or invisible. And that's true for both the umbilicus and the abdominal incision, that the ultimate outcome after everything is healed should be not only hidden, but there should be scar-free healing, which will allow an invisible surgery, that you see the perfect results without having to look like you've had surgery in the past. Looking at the next slides, we're going to go through the different stages, the steps of an abdominoplasty, how it's technically performed. First, the marking that you see are basically the location of the incisions. There's an incision which is well hidden by a string bikini or a small underwear, so that the location of the incision is completely hidden from the eye. And also there is an incision inside the umbilicus, which if perfectly done, you could have an invisible umbilical scar, as I will demonstrate in the future. Next, we undermine the skin to free up the skin from the underlying muscle. And as you can see, we don't really enter the abdominal cavity. This operation is completely performed just within your skin and over the muscles of the abdomen. And so the recovery is a lot easier than having to undergo an abdominal procedure, such as a C-section. After undermining the skin and freeing the umbilicus, we go ahead and tighten up the muscles, and that is called imbrication. We put the muscles back together. I usually do this in 2 separate layers to create a layer of safety in case the patient coughs or laughs very hard right after surgery. We want to make sure that there's a degree of insurance in this closure so that nothing loosens up over time. And by doing this, we're also bringing the waist back in and creating that contour that is very youthful and aesthetically pleasing. In the next slide, you can see the patient is flexed and the excess skin is pulled down, and it's measured exactly how much skin is loose and can be removed, and the excess skin is removed. And in the final stage, we close the skin, and it has to be a perfect closure. It's a multi-layer closure, the deep layers and superficial layers, and everything is done in a way to ensure that you have a beautiful seamless closure that over time will heal naturally and will not have a scar that is palpable or visible, and have an aesthetically correct outcome. Drains are placed, of course, and at the last stage we put a binder on and the patient is awakened from procedure. The total procedure lasts anywhere between 2 hours to 4 hours, depending on the amount of work that needs to be done, and the patient is then taken to the recovery room. So what are the nuances of an abdominoplasty? There are nuances in a tummy tuck. It's very important that the experienced plastic surgeon pays attention to all of these factors to make sure that we have a perfect result. We want to have a natural aesthetic contour. We want to have a natural looking belly button. We don't want it to look like it's a surgical result or that there's a deformity which is visible from across the room. The surgery itself should be as invisible as possible. You should not look like you've had surgery. You should look like you were perfect to begin with. We want to deepen the curves in the waist. We want to remove stretch marks as much as possible. The stretch marks that are below the belly button are removed. The stretch marks that are above the belly button move down, but they also become flattened. And they become very susceptible to further treatment with laser treatments, and we can do a lot of things to even improve those. But as a whole, the stretch marks look a lot better and a lot fewer. The muscle contours I already mentioned. I really pay attention to making sure that the hip muscles are visible, that the curvatures are all perfectly in line with what a youthful abdomen would look like. And last, I commonly perform liposuction in areas such as the lower flanks, and some of this fat can be actually transplanted or grafted to the buttock areas, and we can really deepen those curves, and by filling up the buttocks, we can create these youthful curves that the patient hasn't had for many years and makes a lot of people very happy. So the natural result, basically, there is no surgery visible. You have an invisible umbilical scar, you have an incision that's hidden within your bikini, and even after a year, it should be invisible without a bikini. You should have a scar that is not really bothersome to you. The muscles are tightened, and the waist have a natural curvature. In the next slide, we go over a tummy tuck preparation. Some of the most important things: no smoking before or after a tummy tuck. I actually like my patients to quit smoking, if possible. If not, we would like them to stop smoking for several weeks before and after, for the specific reason that there is a high chance of skin necrosis or a very poor outcome with smoking if the patient's having a tummy tuck. I like patients to stop taking nonsteroidal anti-inflammatories, aspirin and Motrin, or even fish oil for a few weeks before surgery to make sure the chances of bleeding are as low as they can be. We want you to avoid alcohol because I don't want you to be dehydrated. We want to make sure that there's no liver toxicity or any issues, and that you have your best healing shoes on after surgery. We want you to be well hydrated. We prescribe some supplements which are helpful to the post-op recovery, but I want the patients to really avoid diet pills and herbal supplements. In the next slide, the aftercare is just as important. Some of my patients, I use a pain pump to decrease pain for 3 days after surgery and have a very smooth recovery. In all my patients, I use a muscle block and really numb up areas so that for several hours after the tummy tuck, patient doesn't feel any pain at all. Drains are almost always used in my case, in my practice, because we really want to avoid seroma formation. And even though I could potentially, using the techniques that I do, not use drains, I don't find any reason why a drain should not be used. It's safer and it allows us to have a faster recovery. Exercises, I always have the patients perform safety exercises such as breathing exercises and toe exercises right after surgery, and then we proceed to allow you to do more, and we actually have a whole list of things that you can do both in terms of diet and exercise afterwards. But I'd rather if you're not really dieting when you come in for your tummy tuck, because again, we want your body to be able to heal well and go through its natural healing process before you try to lose weight again after surgery. The general inclination, though, is after a tummy tuck, the majority of patients, if they wish so, can lose a significant amount of weight. And it's for two reasons that this happens. One is you feel so much better about yourself that it really changes your lifestyle and makes you more physically active. And you go to the gym, and that helps you lose weight. And second is that by tightening the muscles, a lot of patients actually come back and say that they have decreased appetite and they lose weight because they feel full much sooner, which wasn't the case before the abdominoplasty. Some patients I send to an aftercare. I love the aftercares that take care of my patients and make your experience a lot more comfortable. And if my patients request it, we always send them to an aftercare, and in some cases we require it for the patient. So I believe that tummy tuck is an amazing operation, not because it is the most complicated or risky of operations. In fact, I believe that it's not a risky operation, but I believe that it's an operation that allows the patient to undergo personal transformation. And I see this all the time. And that's why I want to put time in a separate video going over photos of before and after cases where patients really underwent personal transformation. But we have a case here that I want to show you in the next slide. Looking at this patient, she had a bariatric procedure. She had a gastric bypass done laparoscopically. She lost about 100 pounds. On the left, we can see her photograph from after having lost 100 pounds. She came to see me and she just wasn't happy. She had loose skin, her abdomen was protuberant, she had stretch marks. She just felt that her weight loss really hadn't accomplished for her what she needed. On the right, we can see her a year after. You can see where her laparoscopy scars are now much lower. That's where the tummy tuck was performed and everything was moved down. Her muscles were tightened. And you can see how much better she looks. And this really empowered her to go forward, go back to the gym, take care of herself. She actually lost another 35 pounds after this operation, which we can attribute not just to her bariatric procedure, but also to having undergone the tummy tuck, which empowered her to take better care of herself and move forward to what her challenges were. And she was very happy with her outcome. Ultimately, I hope that this video has been helpful in describing what a tummy tuck procedure is. In the next video, I will be talking about specific cases and who really qualifies for an abdominoplasty.